Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor of nursing practice. The case for today is types of psychotherapy. Psychotherapy is not one single method. It is a broad term for structured therapeutic conversations that help us understand emotions, thoughts, behaviors, relationships, trauma, identity, coping patterns, and life stressors. The best type of therapy depends on our symptoms, goals, history, readiness, culture, personality, and level of distress. Many therapies also combine approaches rather than using one single model. The American Psychological Association describes several major therapy approaches, including cognitive behavioral, interpersonal, psychodynamic, humanistic, and integrative forms of therapy. Let's look at the different types of therapy. Cognitive behavioral therapy, or CBT, is one of the most widely used forms of psychotherapy. It focuses on the connection between thoughts, feelings, behaviors, and physical reactions. CBT helps us notice unhelpful thinking patterns, challenge distorted beliefs, and practice healthier behaviors. It is often helpful for anxiety, depression, obsessive-compulsive symptoms, insomnia, panic, phobias, stress management, and coping with medical illness. CBT is practical and skill-based, so it is useful when we want tools we can apply between sessions. Dialectical behavioral therapy, or DBT, grew out of cognitive behavioral therapy but adds mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness skills. It is especially helpful when we experience intense emotions, impulsive reactions, self-harm urges, suicidal thoughts, relationship instability, or chronic feelings of emptiness. DBT teaches us how to survive emotional storms without making the situation worse. The National Institute of Mental Health notes that DBT has evidence for reducing suicidal behavior and suicide attempts in certain populations. Acceptance and Commitment Therapy, or ACT, ACT, helps us stop fighting every painful thought or feeling and instead build a meaningful life guided by values. ACT does not require us to eliminate anxiety, grief, pain, or fear before taking action. It teaches acceptance, mindfulness, cognitive diffusion, and committed action. It can be helpful for anxiety, depression, chronic pain, trauma-related distress, perfectionism, avoidance, and life transitions. ACT is especially helpful when the main problem is not only emotional pain, but the way we have become trapped trying to escape that pain. Psychodynamic therapy focuses on unconscious patterns, earlier relationships, attachment wounds, defenses, unresolved conflicts, and repeated emotional themes. It helps us understand why we keep responding in certain ways, choosing similar relationships, or feeling stuck despite insight. This type of therapy can be helpful for long-standing depression, anxiety, relational problems, identity concerns, grief, trauma history, and personality patterns. It is often deeper and more exploratory than skill-based therapy. Interpersonal therapy, or IPT, focuses on relationships and life roles. It helps us examine grief, role transitions, conflicts, isolation, and communication patterns. IPT is often used for depression, especially when symptoms are connected to loss, major change, relationship stress, postpartum adjustment, or social disconnection. It is helpful when we need support understanding how emotional symptoms and relationship patterns influence each other. Trauma-focused therapies are implemented when the nervous system and sense of safety have been affected by trauma. These therapies might include trauma-focused CBT, prolonged exposure therapy, cognitive processing therapy, somatic therapies, and eye movement desensitization and reprocessing, or EMDR. These approaches can help with post-traumatic stress, intrusive memories, avoidance, hypervigilance, shame, emotional numbing, and body-based fear responses. Trauma therapy must be paced carefully. The goal is not to force us to relieve the trauma, but to help the brain and body process what happened safely. Humanistic and personal-centered therapy emphasizes empathy, authenticity, self-acceptance, personal growth, and the healing power of a safe therapeutic relationship. The therapist provides a non-judgmental space where we can explore feelings, values, identity, and meaning. This type of therapy is useful for low self-worth, life transitions, grief, identity development, relationship concerns, and people who have felt invalidated or misunderstood. Family, couples, and systems therapy looks beyond the person and examines patterns within relationships, families, and social systems. It is helpful when symptoms are connected to communication problems, conflict, parenting stress, caregiving strain, blended families, separation, betrayal, or chronic relational tension. Instead of asking only, "What is wrong with this person?" systems therapy asks, "What patterns are keeping this problem alive?" Supportive therapy provides emotional support, stabilization, encouragement, coping strategies, and problem solving. It might be especially helpful during a crisis, illness, grief, burnout, major stress, or periods when someone is not ready for deeper trauma work. Supportive therapy is not less than other therapy. Sometimes, especially during instability, it is exactly what the nervous system needs first: safety, grounding, and steady support. Overall, psychotherapy is most effective when the method fits our situation. Sometimes we need practical tools, sometimes we need emotional regulation skills, sometimes we need trauma processing, sometimes we need relational repair, sometimes we need meaning, grief work, or a safe place to be heard. Good therapy is not about forcing us into one model. It is about choosing the right approach and at the right time. If you'd like to explore the topics I discuss in my channel, you can find more information in my book, Through the Storm by Maria Piedad, DMP, available on Amazon. If you enjoyed the video, please like it, comment, share, and subscribe to the channel. See you in the next video.